Remember the year 2020?
Our top story this hour, the Wuhan coronavirus. New cases have been reported in the region, and governments have tightened screening measures to contain the outbreak as the Chinese New Year travel rush peaks.
Japan has confirmed its first case of the virus.
There are now 6 people in the US infected with the fast-spreading virus.
The virus is getting stronger, the number of infections are likely to rise. We just have to be psychologically prepared that this can get worse than SARS.
We saw our first reported case on the 23rd of January. Given the high volume of international travel, we do expect to see more suspect and confirmed cases in time to come.
Many of us would not have believed that life as we know it would change. Movie screenings, travel getaways, social gatherings, weddings, and everything we took for granted all came to a standstill. When the world received its first reports of pneumonia cases, the impact and severity of the virus was not yet known. What followed after was a disruption to social norms and uncertainties, with many worrying about its impact on jobs and the economy at large, food supplies, and even essential services.
The new virus is more infectious than SARS. Therefore, it's harder to stop it from spreading. The situation is still evolving. In the last few days, we've seen some cases which cannot be traced to the source of infection.
Today, the task force has deliberated carefully and decided to raise the risk assessment to DORSCON Orange.
Given the latest developments, we will now step up further precautionary measures.
Aspects of our daily lives eventually surrendered to the virus. This brings us to remember what we did and how we protected ourselves and our loved ones. At the onset of the pandemic, the Singapore government took steps to ramp up surveillance and to be on the lookout for recent travelers from Wuhan with pneumonia. More than 7,000 personnel from the Ministry of Defence, the Singapore Armed Forces, and the defence technology community answered the call of duty and deployed across the various national frontline COVID-19 operations.
If you treat COVID as the enemy, you know very little about it. So you have to work with people who know more. In this case, whole of government operations. And you have to work with other players to achieve the outcomes.
In order to tackle COVID-19, the SAF scaled up its responses in these 5 areas of support, with 6 task forces. For instance, the Health Surveillance Task Force was stood up to support the Ministry of Health in health surveillance, contact tracing, and enforcing stay-home notices.
So we were stood up second day of Chinese New Year. We were doing temperature screening at Changi Airport, supporting CAS and that.
The thermal imagery equipment has actually allowed us to screen a large number of the incoming passengers, high-risk passengers. They will be transported straight away to the hospitals or nearby clinics to get a proper swab test.
Additionally, temperature self-check kiosks were deployed at various public spaces and SAF camps. This system was jointly developed by engineers from the Defence Science and Technology Agency and a local engineering firm, which proved to be a quick means of screening the community.
It took about 2 weeks from the conceptualizing of the idea to the development of the prototype, and another 2 weeks to ensure that the system is robust in its performance. So we actually deployed the system for trial. The public response has been very positive. It was really good because now they can just have a clear indication of whether they are healthy or not. All they have to do is really stand on the footprint, right? Look at the device, and then it will give them a visual feedback as to whether they are okay or not okay. And when we deploy at the SAF camps, because it really helps to elevate the workflow, as well as to protect the soldiers and not put them at the risk of being frontline temperature screening stations.
Upon confirmation of a COVID positive case, contact tracing is initiated. Teams of personnel from the SAF and Home Team assisted the Ministry of Health and the Ministry of Home Affairs in contact tracing, as well as daily health monitoring of at-risk groups and persons issued with stay-home notices.
We set up a total of 7 contact tracing centres. We increased the capacity about tenfold from what they had in MOH.
Actually, at the start, when there was a great need for the contact tracing centres to be increased from 2 to the final 7, all of us have to play our part. All of us step up. We never ever look at the roster to say, hey, when was our next off, but rather what is required of us, and that's the truth.
The greatest challenge for being a contact tracer is that given the numbers of calls that we need to make, other than being able to converse in English and my own mother tongue, the members of the public speak to us in other languages as well. They thank us, like for example, thank you for your contribution, thank you for calling us, thank you for checking on us.
I think it's quite clear that the lives of our families, our way of life are vulnerable for as long as the virus remains uncontained. I think we were very clear that this is something that we have to do, that we would step up and we would step forward.
The contact tracing process includes the creation of an activity map, outlining a full history of the person's activities, movements, and the people whom he or she had been in contact with in the last 14 days prior to the onset of his symptoms, up until he is diagnosed and isolated.
Our mission was to detect and trace cases, and also to contact the close contacts of these people and to issue quarantine orders to them, such as we will be able to stop the transmission there and then.
On a daily basis, we have to be on our job for 12 hours. The operations move very fast, and then we have to keep up to the pace, so this is a key challenge that I faced.
My role is to develop technical solutions to support the SAF in the COVID-19 response. I work in a multidisciplinary team from DSTA to develop the network analysis tool to enhance the contact tracing effort. When you have 1,000 over cases every day, it's very difficult for the contact tracers to look at all this information all at once. So how the network analysis tool comes in is it fuses all this information together to form this big visual diagram where it's able to illustrate the relationship between the different cases, any potential relationships between the cases in a very clear manner.
After we have processed the data, what they will be used for is that they will generate a heat map out of it, and then we can see where are the hot spots where these patients have been to. We will be able to sieve out more cases in the community which is hidden among the population.
From participating in multiple outfield exercises and peacetime operations, I think we have developed qualities that put us in a place where we're able to practice them in the real-world situation.
I'm proud to take part in this operation, contribute back to the nation. We play a part in supporting nation efforts in fighting COVID-19.
Having to keep an eye out for the next COVID positive case was a huge undertaking. Fortunately for us, help came along in the form of an app.
I worked with other MOH divisions in developing what was known as CMS, COVID Management System, and assisting GovTech in operationalizing tech enablers like Trace Together and Safe Entry. You're always on your toes trying to figure out how more you can help.
Every day we're just dealing with tons of data, sifting it through, making sure that it's correct before we pump it down so that the people can take action on the ground. My key job was to make sure that the info not only flow as fast as possible but accurately as well.
As the rate of contact tracing increased, the SAF developed Swift Cobra, a central database to organize and process massive amounts of data efficiently. This allowed tracers to have a clear oversight in the contact tracing process.
We came up with this idea that maybe what we could do is we create a central database so that when members want to look at a certain case information, they will go into this portal and treat it as the single source of truth.
To better ring-fence the virus in the community, close contacts of people infected with COVID-19 were transferred to government quarantine facilities.
Basically, most are quarantined at home. For some people, home quarantine is not feasible, and therefore they're quarantined in a facility like this. Also, people with recent travel history to Hubei are also quarantined. We have about 2,000 spaces, and we want to make sure that everyone who's under quarantine is well taken care of.
So as our staff are being deployed here, there are more than 200 overseas staff. They are deployed daily to process entries into the facilities, conduct patrolling duties, and provide whatever assistance required by the POQs.
May and June period itself, there's an outbreak in the domes. We need space to decant all these foreign workers, and therefore NSRCC use its Changi site for these workers. Our facility not just serving our members for their leisure needs, but it can serve different purposes at different times of crisis.
Upon the implementation of safe distancing measures, there were those who struggled to cope with the safety measures put in place to prevent the spread under the new normal. To help with this transition, teams comprising MINDEF and SAF volunteers worked with other whole-of-government agency volunteers to make rounds at various high-traffic areas around Singapore, reminding the public to mask up and practice safe distancing. These enthusiastic Samaritans were our safe distancing ambassadors.
We've had people coming to us and explaining to us why they are out. They are all frustrated, not being able to come out and do things and all that. And we always advise them that if they don't need to come out, stay at home.
So we have to speak to them, help them to understand why we are rolling out this safe distancing measure. So we also let them know that by adopting this safe distancing measure, they are actually helping not just themselves, they are also helping the community. At the same time, they are also helping their loved ones.
I applaud the SAF because to come forward to help us tide over this critical period. So I'd like to say thanks to all those people, and I think they did a very excellent job. Well done.
The priority is the safety of our family.
So I really salute to them because I don't think anybody can do that. You know, you need to have really a very noble and a great heart. Yeah. Singapore is so good with their medical, healthcare, you know, all the precaution, but there are still risks.
Since the outbreak, COVID-19 continued to pound on Singapore and Singaporeans like the unceasing waves that hit our shores.
There could be a long road ahead. We are not sure how long this virus will turn up. Therefore, we must stand ready to respond to new developments as the situation evolves.
Panic buying and hoarding spreads over fears of the COVID-19 virus. The panic buying comes amid concerns by the WHO that masks and other protective equipment are running out because of rising demand.
We were activated to help to procure the PPE. We email and we cold call the suppliers to ask them whether they have any available stocks for us.
The key challenge is about the time, pack and distribute the masks so that the masks can get to the household to assure the country that we have enough masks to look after their well-being.
While we wish it to be contained, if it doesn't go the way we want and it spreads, then we have to be ready